Good evening, everybody. Sorry, there was a crazy car going off out down my road. So anyways, got me a little distracted, but here we go. So today is June 11th, Thursday, and I'm going to actually change it up a little bit with respect to the statistical analysis that I present you with. Normally I do the sort of rundown of how many cases we have in Sonoma County, but that hasn't been updated for this evening, and there was actually a mathematical error that a constituent caught that has not yet been corrected, so I don't want to share that information until it's been corrected. I do want to start off with some updates with respect to reopening. So tomorrow, wineries, breweries, and tasting rooms will be allowed to open. Now, these were actually already allowed to open, but only if they served meals. So now they'll actually be able to open regardless of whether or not there is meal service incorporated. And normally Dr. Mace wants to sort of set a once every 2 weeks we go through, further reopenings, but she made the exception here because they were actually already open, and there's literally no difference with respect to risk in terms of whether you serve food or not. And actually you could make an argument that serving food increases risk rather than decreases it because you're having actually more prolonged contact. She went ahead and is going forward with that amendment. It will take place and take effect at 12:01 a.m. tomorrow morning. Up that opportunity for tomorrow. Now on June 19th, that is going to be the next really significant phase of reopening. On June 19th, we are anticipating, assuming that we do not have any red flags, and we would be looking for multiple red flags or multiple metrics in which we are not actually in compliance with the state guidelines. So just want to be clear, there's an asterisk to this, but assuming no red flags, on June 19th, we will move forward with opening campgrounds, hotels for tourism, bars, gyms and fitness centers, movie theaters and family entertainment centers, zoos and museums, day camps, schools, pro sports without a live audience, film, television, and music production, as well as casinos and card rooms. So that is coming on June 19th. Now I want to share some statistics from our COVID-19 update with the Board of Supervisors that we received earlier today. These ones are with regards to patients who were ever hospitalized. I've been getting a lot of questions over the past few weeks from folks who really wanted to know, okay, if you wound up in a hospital in Sonoma County, what were those demographics? What were those people like? And I can now tell you that 13 of them were in the age range of 18 to 49. 15 of them were in the age range of 50 to 64, and 14 of them were in the 65 and over category. So I think it's really important to recognize that we are actually seeing the majority of our hospitalizations in the sort of broadly under 65 category, including 13 of those folks were in the ages of between 18 and 49. So I want you to be clear that, there is still risk even if you are a younger person. 50% of those hospitalizations were female, 43% of them were male. 27% of them, this is also really critical, had no underlying condition, right? So there was no clear complication that you could say, oh, that's probably why they wound up being hospitalized. 39% of them did have diabetes, 27% suffered from cardiovascular disease, 17% suffered from chronic lung disease, 17% from hypertension, and 17% had other co-occurring conditions. With respect to how we are meeting the state criteria, these are the metrics that we are tracking on a daily basis, to make sure that we are doing okay and can keep moving forward with our reopening process. Our current case rate is 30.8 per 100,000. We are currently returning around 2% of our tests are coming back positive. I do want to acknowledge, though, that that's actually in the teens if you're looking at close contacts. I believe the number was 18%, but don't quote me on that. But it's substantially higher when you look at those high-risk demographics. So 2% is overall, including those ones, the tests where you can call, you can go and get them. So not just the high-risk demographics, but 2% overall. We have seen an 18% average increase in hospitalization rates over 3 days, but Dr. Mace sort of has an asterisk on that number, recognizing that those numbers can fluctuate very widely because we have so relatively few hospitalizations overall. Having just a couple more people can cause a pretty substantial jump in the percent hospitalization rate. We currently have 79.3% of our ventilators available and 22.4% of our ICU beds available. Importantly, Dr. Mace also shared with us that the sort of major models that are currently, modeling COVID-19 infection rates around the country. And I want to recognize, our models haven't always been perfect in the past, right? And they can be augmented or altered based on behavior, right? What is that actual effective transmission rate in a community can be different from the overall R naught of the disease. But the models are suggesting a second peak in the fall, sort of around September. And those models that we're looking at include Johns Hopkins, the RAND model, as well as COVID Act Now. So if you check out the Board of Supervisors meeting from this morning, you can actually see the graphs and see exactly when they project those peaks to occur. I also want to acknowledge that we continue to see a disproportionate impact racially in Sonoma County. 75% of our cases are taking place in the Latinx community, 20% in the white demographic, 3% in Asian Pacific Islander demographic, and 2% other. With respect to looking at why are our Latinx community members being disproportionately impacted by this disease, we've identified a few trends. Trends are they tend to be younger. 86% are under the age of 50. It is more often due to contact. People are also more often asymptomatic and less likely to have an underlying condition or to wind up hospitalized. While these are more often due to close contact, some of that close contact is taking place in the home, some of that close contact is taking place in the workplace, and we are seeing workplace clusters. And if you go to socoemergency.org, you can actually see the breakdown by sector of where we are seeing the cases. I also want to acknowledge that Dr. Mace did provide some information regarding overdose deaths as well as suicides, because there have been a lot of conversations around the mental health impacts of the pandemic response. Overdose deaths were heightened in March and April, but actually below average in May 2020. And suicides have been occurring less frequently than average since March of 2020. However, mental health remains a top priority of the county, and I would encourage you to check out the Warm Line. If you need any assistance, we have therapists that are available and ready and happy to talk to you. All right, I'm going to go ahead and turn it over to questions and see what I can find over here. I apologize, I don't have my husband as an assistant right now. He's downstairs trying to get the baby to sleep, and I am up here in what I call the upstairs oven. I think it's about 90 degrees from the heat today. All right, just scrolling through to try to find the first question. Okay, question 4. Rapid rehousing funding plans for when eviction moratoriums end? Absolutely, this has got to be a top. We are definitely looking at emergency rental assistance. The bad news is that we are in dire financial straits with respect to the amount of money that we have had to spend in local government responding to this pandemic, and also the decreases that we are expecting in our revenue sources. However, the good news is that the CARES Act funding, which we are expecting to be allocated from the state of California, is around $50 million. We have about, I believe it's $34 million of hard costs that we need to pay with that. That's just the direct disaster response that the county had to, that's what we spent on, for instance, workers who are repurposed to focus entirely on the coronavirus pandemic response. Other hard costs like that, standing up the ACS, those kinds of things. But we're expecting to have hopefully somewhere between $8 and maybe $16 million that we could potentially invest in community priorities. And I know that one of my top priorities is making sure that folks are stabilized and able to stay in their homes. So that would involve rapid rehousing or emergency rental assistance to keep folks in their homes in partnership with our community-based organizations. The Board of Supervisors did also sort of formally commit to hiring an officer. That officer will provide some input on how to make sure that our CARES Act funding is dispensed in a way that really directs funds to our most vulnerable members of our community. So that's another hopeful good step in the right direction. Okay, scrolling down for other questions. And let's see. Hospitalizations are very important for public to know about. Absolutely, I completely agree. I was glad that that information was finally able to come online. Sorry, I've got all these messages that people are watching. Here we go. I've got a message from Daisy asking, why do you think the Latinx community is highly affected the most? I think that it's really important to recognize that this pandemic is disproportionately impacting the Latinx community, not just medically, but also financially. And because of long-standing racial inequities that we see in our society, wherein we see a lot of Latinx workers on the front lines in some of those most high-risk positions. And those most high-risk positions are those direct service positions, right? Where people are more likely to be exposed to COVID-19. And then we're also actually seeing, of course, the fact that we have a lot of those folks in frontline positions in the hospitality industry who have unfortunately lost their ability to work because until the 19th, tourism was not allowed in Sonoma County. And so those are some of the reasons that we're seeing. Early on, a lot of folks were saying things like, well, it's because of in housing and those kinds of things. But the fact is that you actually have to have that infection introduced into that family in order for it to spread. So how did the person get it in the first place? And I really believe that goes back to the fact that the Latinx community tends to occupy those higher risk positions. So we need to make sure that we are absolutely testing aggressively, offering testing to that community that's accessible. Sometimes people are actually right now afraid to get tested because they're afraid that if they get tested and they test positive, that they will lose 2 weeks of work and that they can't afford to lose 2 weeks of work. So that's why having the safety net is really critical. We need to make sure that we have emergency rental assistance. We need to make sure that we have food for people so that they feel safe enough to go get tested and to know that they will be supported if they have 2 weeks off. I also want you to know that the Board of Supervisors unanimously voted to move forward with actually coming back with a paid leave requirement locally. Unfortunately, the CARES Act had a mandatory requirement for some businesses to actually provide 14 days of paid sick leave to their employees. But believe it or not, they exempted the largest businesses in the country who are most able to afford this. So businesses with over 500 employees, which includes 500 employees nationwide, right? So that would include, Pizza Hut, McDonald's, Taco Bell, all of the major sort of chain restaurants, Walmart, right? Costco, these kinds of businesses actually didn't have to provide that 14 days of sick leave. And so we're actually looking to see if we can implement an ordinance locally that would make them step up and do the right thing. All right, next question. I am scrolling down. Sorry, it's taking me a little while because I don't have my assistants. Let's see. I'm at the bottom and I'm not seeing any other questions. So feel free to jump in and chime on and ask questions. Sounds like my goat is asking questions outside, if you guys can hear that. Just popped on. Question, tourism. Will it be limited to just visiting and booking lodgings Friday through Sunday beginning, see if I can see more. I'm going to assume, if all are healthy enough, June 19th, or can a guest book longer? Oh, that's a great question. So there is no limit on the duration of the stay. As of June 19th, you will be able to, assuming we don't have any major red flags with respect to suddenly dramatically increasing multiple metrics in our, dashboard that you can go and monitor online on socoemergency.org, people will be able to stay in our guest lodgings in Sonoma County starting the 19th. And so they could stay for, of nights. It's not just Friday through Sunday. Friday is just the first day. And I actually want to thank Dr. Mace. She attended a meeting with a lot of different representatives from the tourism industry, including small business owners, the head of Sonoma County Tourism, the head of the Sonoma County Hospitality Association. Originally, we were planning on reopening exactly 2 weeks from the last reopening date, which was a Saturday morning. But she actually moved it up to Friday evening to allow folks to get that. We received feedback that, there were a lot of businesses that, a lot of people come up for the weekend and they stay Friday and Saturday night, not Saturday, Sunday. So we were able to make that because it was a very small difference epidemiologically, right? Only a matter of hours, and a pretty substantial difference economically. So that was one of the reasons that she made that decision, and I really appreciated that. I've got a question from Jen. Am I going to vote to give Iolero more authority? Absolutely. I really do believe that citizens' oversight over law enforcement is absolutely critical right now. There is a movement across the country, and I have been so inspired by seeing the peaceful protest, by seeing the youth-led protest, by seeing the organization that is taking place at lightning speed around social media, and people are asking for change, and they're asking for really thoughtful change. If you go to 8can'twait.org, you can see, a number of policies that could be implemented that would reduce the use of force. in the community with respect to policing. But we need to take it a step further, right? It can't just be about what are the good policies today. We need to create institutional change that will actually allow for those best practices to be brought into the law enforcement system next year, the year after that, right? Making sure that we are always keeping pace with best management practices that will keep our community safe and avoid police violence and unnecessary targeting of communities of color. So for that reason, I support citizens oversight. I support the Evelyn Cheatham ordinance, and I look forward to working with the chair of the board, Susan Gorin, to get an ordinance that will actually strengthen that office and provide enhanced citizen oversight to make sure that we have that going on in our community going forward. All right, looking for the next question. Tammy asks, do you think that they may feel racism is the reason they are targeted for aggressive testing? And I assume that this would mean sort of the Latinx community with respect to the disproportionate impacts and for aggressive testing. I cannot purport to speak for the Latinx community, so I don't really feel that it's my place to answer that question. However, I do think that we need to make sure that we have culturally sensitive testing and culturally sensitive messaging as well. I mean, in October of 2017, the county did an abysmal job of responding to our Spanish-speaking community members. In the midst of the most worst, at that point, disaster in the county's history, the worst wildfire that we had ever gone through, there was literally no communication that was going out to Spanish speakers in any meaningful way. And we've come a long way since then, but we still need to keep improving. And we need to keep hiring bicultural, bilingual folks to work within county government to make sure that we are speaking in ways that are effective, that are not triggering in any way, shape, or form, and that are culturally sensitive. So I do think that we need to keep working on that. But with respect to, the concerns of the Latinx community, I always like to hear directly from them what their concerns are. All right. Let's see. I got the question about the tourism and the booking town. Let's see. Question from Dawn, which is, when are the courts opening? We have squatters who are refusing to leave a house of ours in Rio Nido. Drugs are highly suspected. Sheriff has been called out there multiple times, etc. That is something that we can look into. I did receive an email from our district attorney, Jill Ravitch, and I believe that it cited the reopening of courts and sort of that phased process. I do not have that information at my fingertips, so I promise that I will look that up and I will post it in the comments after this to make sure that you get accurate information, because I don't want to misspeak. All right. Comment from Wendy. Masks are very unhealthy to wear for extended periods. Their effectiveness in stopping viral spreads is questionable. People who are working are having to wear these masks for very long periods of time. Is there an end in sight to this mask wearing order? I have not heard any information from Dr. Mace regarding an alteration to the facial covering order at this point in time, but I will certainly let you know. I did see actually in the news just over the past 24 hours, I believe, that there was a new study that came out suggesting that facial coverings do have a positive impact in terms of reducing transmission. And it's always important to remember this is not during the fires. So when you have wildfires and you had folks who are wearing respirator masks, that was really to prevent the particles coming into their lungs, right? This is really to prevent your particles from being shared with others. So again, the masks are not for your neighbor, and so that's why it's important that your neighbor wears them so that they can protect you. I do acknowledge, though, that it can be challenging, especially as the temperatures creep up, especially for folks who are working in in settings where they have to wear those masks all day, that it can be challenging. But the good news is that there are a number of different small businesses that are making masks, including ones that are lighter weight but still count, right? Still have sort of enough to do the job, but they're a little bit cooler. So might want to check out some of the wonderful local sewists who are doing some beautiful local masks. All right. Question from Deb. I saw a slide that showed a great disparity in millions of dollars spent in our county. 1.7 million for community services and housing versus 59 million for the police. Are you all addressing that going forward with respect to defunding additional monies for police? So I am guessing that slide probably was for the city of Santa Rosa, budget numbers, because our budget numbers tend to be larger than that, right? Our budget is closer to $2 billion overall, and so the pie is a much larger pie. So it's definitely something that is on our minds, and we had to kind of do an odd budget process. Normally, budget is happening right now, and we are having these really big, sort of knockdown, drag out budget hearings where we hear from department head, hear about their needs, hear about their members of the community about their needs and wants, and then try to sort of, make all of this sausage into something that is palatable and in the best interest of the community. So we actually did, for the first time since I've been on the board, and I believe that since anyone else has been on the board, a pass-through budget. So we're actually keeping it as is until we know more. We're waiting to see whether or not that CARES Act funding comes in. And we're also sort of waiting to see what is the actual revenue impact of the COVID-19 pandemic. How is it affecting our departments who provide other services? Are they seeing increased demand for services or reduced demand for services? Are they seeing an increase in the fees that they're collecting or a decrease in the fees that they're collecting? So we're still trying to learn more so that we can actually come together with an accurate budget. But the $50 million of CARES Act could be a potential source to address some of those inequities and could provide some funds for some critical community investments. We definitely spend far more than $1.7 million on community services and housing. And we did also just receive some ESG funding from the federal government that will be able to address some of those conversations around emergency rental assistance, addressing homelessness, and things like that. So yes, and I really want to make sure that, especially now, it's been actually wonderful in some ways to have virtual meetings. They totally drive me crazy, but we have seen more public participation at Board of Supervisors than we have really since I've been in office. And, usually with the Board of Supervisors meetings, right, you'll have one or two controversial items, and everyone will come out for those one or two controversial items, but then not really come out to the other ones. But I think there are more people tuning in now that we have these virtual settings, and more people actually commenting and sharing their feedback on pretty much every single item that we are talking about. So I'm hopeful that when it comes back to the budget, which we'll see again at the end of July, that I'll be able to hear more directly from all of you about what your budget priorities are, and that will really inform and shape our budgeting process going forward. All right. Question from Ian. Why is the Forestville Farmers Market so late in the season? It would seem that a lot of people would benefit from it starting slightly earlier. That is a great question, and I would have to reach out to market managers. So farmers markets have been allowed all along. They were never prohibited by the public health order, and all of the different farmers market managers are different, and they have their own schedules, and they have what they do. So I would encourage you to reach out to the market manager and just check in and see what was going on. It might have been personal. It might have been challenges that they were having and getting it together. I'm not sure. But if there's anything that we can do on our end to support that, if they had problems with the county permitting, that's where you call me, and we'll make sure that we take care of that. Question from Daisy. In case these cases keep going up, have you guys thought of the plans of reclosing again? This is a great question, and I actually asked this question of Dr. Mace this morning. So you can check out her answer directly from the Board of Supervisors meeting if you want to go ahead and look that up. Otherwise, I can paraphrase. The goal will be not necessarily, we don't know what the future is going to hold, right? We're in an unprecedented situation in Sonoma County internationally right now, right? We've had pandemics before over the course of human history. That's not new, but the speed at which it can spread is very different right now, right? When you have air travel, when you have vehicles, when you just have more people working in close proximity to one another in cities, those kinds of things are unprecedented, and that's why I say it's an unprecedented pandemic. But Dr. Mace's response was, she doesn't anticipate, suddenly going back into a really strict shelter-in-place order. She anticipates using more of a scalpel and less of a cudgel. So, if we're seeing kind of an outbreak in a certain sector, let's address that through mitigation measures, right? That sector-specific kind of a protocol, as opposed to saying, we all have to go back to immediately sheltering in place the way that we were doing at the beginning of this pandemic. However, I do know that, situations can change. And so, it remains to be seen exactly what that second surge in fall that's being predicted by 3 different models right now could potentially look like. And I'm hoping that we will also have some information for businesses. So I've been asking both our Economic Development Board as well as our Department of Health Services about, we need to have a toolkit, because it's going to happen, right? You're going to have an employee, or you are going to be that employee potentially that has symptoms, that's awaiting a test. And so we need to make sure that we're very clear protocol, both for employees and employers, surrounding what to do when you get sick. And of course, the number one thing, if you're not go to work, stay home, get a test. But it does sometimes take a few days to get the test results back. So we want to make sure that at every step of the way, people know exactly how they should be handling themselves and handling their business if they do employ others. Question from Dana. Any updates on back to school? Yes, and actually, I think Steve Harrington had a press conference live feed or something like that earlier today. I know that there's an article already up on the Press Democrat website, so go ahead and check that out, and that has the latest and greatest information from the Sonoma County Office of Education. Schools will actually be allowed to open, again, assuming we don't see any red flag, numbers going up in Sonoma County, starting the 19th. I haven't heard of any school districts who are planning on opening that early, but they will be allowed by the public health officer starting on that day. What I'm hearing from a lot of different school districts, just checking in with different superintendents, hearing from different board members, a lot of folks are looking at a hybrid model. So having some kind of A-B schedule, offering choice to parents potentially to either continue distance learning or maybe to participate in classroom learning. It's looking like facial coverings will likely be required, although I'm not sure of the age range yet. I haven't heard specifics about that. But again, check out that Press Democrat article that was written, and you can also go directly to the Sonoma County Office of Education to see if that video has been posted. All right, scrolling through for other questions. Let's see. Carol mentioned that there was a good short interview with George Rutherford from UCSF epidemiologist about mask wearing and hand washing. So I will definitely look that up. Thank you very, very much. And Annalise said, with respect to masks, I was told today by an RN that the mask with filters protect you but not others. Any input about that? My understanding on that one, and that's a great question. I will ask that with Dr. Mace, but what I have been hearing just and reading is that it was really the ones with the respirators. So the respirator type masks, right? They're meant to filter what goes in, but actually they allow your breath to escape through a valve. And so that was my understanding. And that there are a number of N95 masks that do have the respirators. So that if you want to protect others, you would not want to use the kind with the respirators. But I will validate that with Dr. Mace because I am not a medical expert. That is just hearsay. But thank you for that question, Annalise, and I will follow up in the comments. All right. Let's see. Teddy says, Supervisor Hopkins, the HUD COC is again undergoing a structural revision this month. Will there be more effort to return it to its originally intended collaborative impact model by including provider subject matter expertise and fewer ideological? And I do not, unfortunately, see the finish of your question. So I would assume that this is referring to our Home Leadership Council, which is our continuum of care body. So HUD is, the Housing and Urban Development sort of federal agency, and then COC is continuum of care. And so we are having conversations regarding what is the future of the Home Leadership Council. There has been a strong desire, and by the way, the Home Leadership Council and the COC, they homelessness funding that goes out and is attributed throughout the county. It is actually mandated federally that we have this particular body called the Continuum of Care Body, and also to include at least one member with lived experience of homelessness. Right now, our Home Leadership Council, which is the Continuum of Care Body, comprised of 2 supervisors, 2 Santa Rosa City Council members. We have 2 folks with lived experience, and then we also have some folks who are representatives of our TAC, our Technical Advisory Committee. And so we're talking about restructuring it because the smaller cities, Sebastopol, Healdsburg, other small cities. Oh, and I forgot, there's also one member on the Home Leadership Council from the Petaluma City Council, which also is its own independent housing authority jurisdiction. So you've got Santa Rosa, Petaluma, and the Board of Supervisors, but Healdsburg, Cloverdale, Windsor, none of the other, Sonoma, Sebastopol, those smaller cities do not have a seat at the table. And there's been a lot of conversation around making sure this is truly a countywide body. And if it's truly a countywide body, you want to make sure that you have geographically equitable representation. You want to make sure that those small cities also have a voice and a seat at the table. And so that's the conversation that we're going through right now. And Teddy, if you have any feedback, I would love to follow up with you on this because I've spent a lot of time. I was on that original committee that restructured the COC back then, and I would love to talk to you about it and hear your input to see what your thoughts are. Other questions. I am scrolling through. Masks and children in school. This is from Donna. Our daughter in SoCal has her children in private school and was told that masks are optional for their students. Of course, that's a private school, not public. How will Sonoma County address mask wearing for children, public and private? So again, there has not been formal guidelines issued by our public health officer. And Steve Harrington has been working on a reopening committee with a number of superintendents from around Sonoma County. So I just sort of saw preliminarily that there was some conversation around facial covering, but I don't know the age and I don't know how mandatory it is. I do want you to know that currently the regulations surrounding preschools and daycares is not mandatory masking. It is sort of encouraging, if you can, students to wear those masks, but recognizing that it may not be developmentally appropriate for all students. And I mean, try getting a mask on a 2-year-old for longer than about 2 seconds. And yeah, I will buy beer if you would, if you could have gotten any of my toddlers to keep a mask on all day. All right. Other questions. Let's see. Question from Jen. Are you going to vote to fund a sanctioned homeless encampment right across the walking bridge in a flood zone on the riverbank from the town square in downtown Guerneville? Do you think a sanctioned encampment way to socially distance the homeless community? So we are actually having a town hall about this next week. So I would encourage anyone from the Lower Russian River who is interested in how to address homelessness in the midst of the pandemic to join our town hall, which I believe is going to be next Wednesday, the 17th at 5:30. And we will have that on Facebook Live and encourage folks to participate then. Here's the challenge that we are facing with respect to homelessness, especially as we move into the fire season. We know that there are folks who are living actually under the walking bridge right now. There were folks who were encamped on the, over by Food for Humans, right? The lot that's being developed by West County Health Centers. We know that there are folks who are camping up in timber, which creates a very significant concern over fire hazards. And I want to be very clear, there is no plan to make, Guerneville the destination, really large sanctioned encampment that will take folks from all over the community. The need is to address the folks who are already homeless in the community. And that will also, quite frankly, facilitate, being able to make sure that folks aren't loitering, say, in the Bank of America parking lot or in other areas downtown. It would give them a safe to go where they have access to food and services right there. And so it would be similar to the Finley Center with respect to having social distancing, but we still are going to make sure that we have a town hall with the community, and we can also discuss other locations. That is one location that is being considered. The Park and Ride was also discussed as a location. There are pros and cons of both of those locations, and I'm looking forward to having with the community. So we will talk more about that on Wednesday, and look forward to talking to you about it then. Oh, and I want to be clear, one other thing about the possible sanctioned encampment, which will have social distancing, right? So the tents would be arranged in a way that they do achieve the social distancing objectives, which are not necessarily happening in other encampments. This would be temporary. So it would run at the latest through December 1st. And so the moment that the Guerneville Vets Hall winter shelter opened up, this would be closed down. So it would be a temporary situation. And actually the technical reason that it would run either through the beginning of the winter shelter or through the end of the pandemic, whichever is earlier. But I think that we all know that this pandemic is not going to be over by December. So we are assuming that December 1st would be the latest date, unless there's a miraculous vaccine that is discovered before then. All right. Other questions. I'm scrolling down. From Iris, am I aware of the timber harvest plan being proposed for Neely Road and Mays Canyon? Yes, I am aware of that. I actually first saw that on social media a few weeks, or maybe even it was a few months ago. Someone posted the formal notification that they had received, because neighbors are required to be notified as part of the process going forward. One of the challenging things is that with THPs, they are entirely under state jurisdiction. So there's actually a CAL FIRE decision that makes that determines whether or not that THP goes forward. We do have various local organizations who've been advocating around timber harvest plans. So you might, if you have concerns about the timber harvest plan, you might be considering reaching out to Forests Unlimited or one of the other groups who have advocated around timber harvest plans in the past. I don't really have any details other than just the map that I saw that was posted online. Question from Carol, will individual districts and schools make their own decisions? Absolutely. So ultimately, what happens is the state issues guidelines, right? The public health officer kind of makes sure that those guidelines are, adapted to our local Sonoma County school system. So she could potentially impose, further regulations or, clarify regulations as appropriate. And the Sonoma County Office of Education is also issuing kind of broad recommendations. But at the end of the day, it is your individual school district that is going to make the decision of exactly what school is going to look like in the fall under those parameters, right? So it's kind of different levels of authority. But at the end of the day, within that box that is created by those other, levels of authority, the school district is the one who decides. And they could decide to go all to distance learning, or they could decide to go, all to an A-B schedule, or if they somehow are miraculously wealthy, which none of our school districts are, they could decide to staff up and, have more classrooms. But The reality is that unfortunately all of our schools are taking a real hit financially, and it's going to be challenging for them to, look at even sort of maintaining their existing levels of staffing in some instances. I will say one bright spot with the schools, I had a great conversation, I think it was last week or maybe the week before, with Bert Whitaker, our director of regional parks, with some local school superintendents and board members, with Land Paths and with the Sonoma County Water Agency surrounding outdoor education. I think there's a fantastic opportunity to get kids outside in fall. And if they can only go to school 2 days a week, on a third or a fourth day, could they go outside? I mean, that would be wonderful. So we're having conversations about project-based learning, about teaching kids biology and science and math right out there in the field. And so that's one of the things that makes me feel good, as a parent, that we might be able to create some opportunities for youth, because it's tough, right? It's tough for the class of 2020 that didn't get to experience their graduation that they had hoped and dreamed of. A lot of students are struggling with distance learning because they don't learn well when they're just in front of a screen. They crave that interaction with their teacher and with their fellow classmates. So it's very challenging, but my hope, fingers crossed, is that we'll have some positive things that come out of this, including a return and an expansion of outdoor education. All right, other questions. Sarah had a question, specifically want to know how much timber will be harvested and what will be done to prevent landslides and runoff. So those would all be questions that would be part of the proposal. Timber harvest plans are pretty substantial in terms of the environmental documentation that's required. So if you can't find that information, we can definitely reach out to our fellow state agencies and see where that might be posted online, make sure that's available. All right. Question from Sarah, any updates on the growing number of RVs on Moscow Road? I will follow up on that one. I know that this was something that we had reached out to CHP about, but we will circle back on that one. So thank you for the reminder. I appreciate that. Scrolling down, will employers be required to give employees more frequent breaks in order to go outside and remove their masks? That is a great question, and I do not know the answer to that question. Generally, the sort of workplace environment is regulated by OSHA, but we do have with these public health orders. That's a great question, and one that I can definitely follow up on. All right, other questions. I'm just scrolling down. Question from Kai, why are none of our school districts miraculously wealthy? What percentage of our budget goes to schools versus, say, law enforcement? This is a great question. This is a question for the state, right? So on a local level, we do not fund schools. It's really the state that funds schools. And unfortunately, there have been decisions that have been made over the years that have not kept pace with the cost that local school districts are facing. My understanding is that schools currently comprise over 40% of the California state budget, and the California state budget is very heavily dependent upon income tax revenue, which of course fluctuates, and especially fluctuates in the midst of an economic recession or depression, which makes it challenging to provide consistent funding that we need, right? You can't sort of say you can have this much one year and only this much the next year of students, teachers who are there in schools. So I agree that we really need to work with the state on establishing priorities. And in my opinion, schools need to be a top priority because there's nothing more important than investing in our future leaders and our future generations. All right, with that, I don't see any more questions. So unless anyone pops on at the last minute with the last burning question, I will bid you all good night and look forward to seeing you at the next one. So take care, be well, and have a good weekend. And I feel like finally we're able to deliver some positive news with respect to reopening, but stay safe out there. We are not through the pandemic. Just because things are reopening does not mean that you can go out and get spring break and sort of return to normal. Take care of yourself, take care of your loved ones, still work, reducing your own risk. And so that means wearing things like facial coverings, trying to reduce the number of contacts that you come in, into contact with. And always remember that, our most vulnerable members of our community are only as safe as the rest of us who are interacting with them. So say if, like me, you've got some grandparents of your children who are potentially serving as childcare providers, that I need to really think about my behavior so that I am not potentially exposing them. So, oh wait, I saw one last question which is Larry Laba, interested in the lack of demand for water conservation from the water agency. They want to lower the flows of the river. Yes, this is true. And if you look at the temporary urgency petition, James Gore and I worked very hard to make sure that water conservation was a part of that. So we will be moving forward with water conservation education measures, because I am not okay with turning down the tap in the lower Russian River unless we are all part of it. Because I don't want it just to be, the folks who enjoy and love and cherish the river taking the hit. We've all got to be careful and conserve water going forward to keep our river and our watersheds healthy. So have a good night, everyone. Take care.